In principle, I wear two hats. I run a clinical laboratory, and then I have my own research theme. And then the clinical lab is really critical for matching between donor and recipient. There are multiple reasons or multiple factors that will determine whether donor and recipients are matched. But the most important one, from my perspective, is the immunological reason, right? The one thing that we think the most about organ transplantation is the fear from rejection.
We do all these transplants, such as kidney transplant, heart transplant, lung transplant, in mice. So we use this to study first how rejection occurs, and also we use it to test new, innovative therapies.
The immune monitoring core is doing tests which are coming up as clinical service in the future, meaning we are developing new technologies for immune monitoring.
The most important thing that we do in the lab is identify those antibodies. We know the donor and recipient typing, the type of markers that they have, and we make sure that we don't have pre-formed antibodies to those antigens. A lot of the times, especially when we have a live donor stepping up and we say it's not a good match, it's because the recipient already have antibodies to this.
Transplant patients have to take drugs to suppress their immune system to prevent rejection of their organs. And so they are susceptible to a lot of different infections, but particularly cytomegalovirus. Many patients have to take drugs after the transplant to prevent this virus from reactivating. And sometimes those drugs, usually they're pretty effective, but sometimes not. Sometimes you could get resistance. And so the virus can cause serious complications for some patients.